out, I'm glad I got out, is to share with my friends as to what it has been with me, and also to, if possible, to tell them not to tread that path which possibly will not take them through what I went through. So that's where I call this a sharing session. Yeah, Neil, thank you.
My first question to you is this small C getting bigger?
You know, it is such a relevant question. We always feared the big C, you know, for the uninitiated. I know there are a lot of non-doctors, so let me just sort of qualify that to say the cancer, right? So we dread that word C. Suddenly, from nowhere, literally from nowhere, in February and March, there's an appearance, an emergence of a very small, tiny virus. Some call it germ, some call it whatever, a virus which decides to attack humanity like nothing before, at least for the last 100 years. And it gets labeled as coronavirus, specifically SARS-CoV-2, that's the virus. And it spreads like wildfire, and it surpasses the category of epidemic and assumes the label of pandemic and attacks the loyalty, the royalty, the ordinary, the special, the poor, the middle class, and the rich. It doesn't spare anybody. So in a way, we are wondering, is this a bigger fear than the bigger C? Or is it getting to be posing a challenge to the bigger C? Because A, detection became difficult, tracking became difficult, tracing became difficult, treating became difficult. All in all, it posed a huge challenge to the medical fraternity. And the regulatory authorities were foxed day in and day out. They came up with a finding the very next week or the next day at times. This virus changed its form, and the medical fraternity went back to the drawing boards, to the research labs to see what more danger can this cause. With the result that even today, the medical fraternity, the World Health Organization, is just yo-yoing on their statements. Sometimes it says it's airborne, sometimes it's aerosol, sometimes it says it comes out of contacts, you need a medium to transmit it. Still, there isn't much clarity because this virus is wild and wily, very cunning. That is where the danger is posed by this coronavirus. So I think it's a fair statement in question that you asked, Neil. Is it getting bigger than the big C? Probably. We'll know with time.
Yeah, it's, I mean, such a deceiving, it's like a chameleon. It changes its color. We're not able to understand. Can you imagine? I mean, all the brains in the world at it, and still we can't even figure out how it's being spread. I mean, that's quite amazing. I mean, sometimes I look at all the labs, all the scientists, all of them around there. I mean, and we still don't know where it survives, how long. I mean, we know few surfaces, firm places, but we don't know the main thing, transmission, we still don't know full on. So sometimes mask is, of course, absolutely necessary, but they say, again, mask doesn't work fully. So you have to have a distancing and blah, 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 you know. Thank you. I mean, that's really getting bigger.
And Neil, you mentioned about the masks. Even in the masks, there's a debate, which type of mask? So
absolutely.
Then the type N95 for the medical, please leave it only for the frontline warriors. Don't use it. That's the message for the ordinary people. And then the ordinary people asking, okay, what do we wear? Oh, a cloth mask is fine. And then suddenly the WHO says that, no, cloth mask is not safe enough. So we have a lot of confusion related to clarity. And that is making it more difficult for general people, general public. Yeah.
One thing, Dr. Kumar, I always felt was, you know, we know this is a very small, tiny virus, which basically through the respiratory thing, it will affect us. But why did the WHO and the thing, they were not talking about masks. They were, even till that thing came up, they were still saying, well, masks, we don't know. I mean, that I think really caused a big problem, and still causing, because there are the whole politics is on mask or unmasked. This is crazy. I mean,
you stole my word, because it's the politics which is actually making it more difficult for the medical fraternity, because the regulatory authorities, the government, and the lobbies are so strong. And I don't know if this is a fair platform to mention the influence of the pharma industry on the government, on the regulatory authorities, is making it even more complex and challenging.
Oh yes, the vaccine and all, and everybody's out to really make big bucks out of this one anyway. So my next question also, I mean, again, it's about your own experience with it. How do you feel on looking back in a rearview mirror? How do you feel? What's your feel?
Like everybody would agree that hindsight is 2020. So when you look back, you'll always feel, oh, I could have done that and I would have saved. I could have done this. But when I look back today and I say that, well, did I actually overcome that challenge? Did that coronavirus leave me survived through those harrowed gates of the hospital? So when I look back, I said that I think I was blessed. The prayers of my family and friends were too strong for the virus to face, and the virus gave in. So yes, it was difficult times. I also realized that for all the care that we took, it wasn't enough, it wasn't adequate. And when I look back, there is no way that I could have probably put my finger and said, I could have probably avoided this, avoided that, because whatever you do, I think, and we all understand as sensible people, we will do only things when we have to. We will not get into a crowded area unnecessarily. We will not go out and venture out into dangerous zones without any compulsion. But having taken all the care also, if at all I went through that, I can only say that I can look up and look behind my parents' photographs and say, thank you for all the blessings, because I actually survived. Yeah, that's what I think when I look back. Yeah.
That's what I mean. As a dentist, we've always been more careful than anybody else, because I guess we've been playing with the virus and bacteria and all that in the close proximity always. And we take that extra care, but still getting that, one small somewhere. So it's so scary that way, like sometimes I feel the mask is not working, or the distance, some people just come. I mean, it's still people haven't gotten, even even sometimes our own medical field friends haven't got it fully. We've been used to wearing masks and doing things, but our friends sometimes, it's nothing kind of thing. No. We've been saying that. Kathmandu has just been hit. I know Mumbai was one of the first cities in India to be hit, and you've gone through so many understanding by now. But exactly, I mean, you don't know where somehow just gets so scary that way. So all sorts of protection is absolutely necessary, I feel, to save ourselves from getting it, right? Would you agree with that point?
No, when you say that we need to take precautions, especially I believe now that Nepal, especially Kathmandu, is right now under complete lockdown, or what you also call as curfew, which means that there will be specific hours allowed for movement, and that to only essential movement, only if you need some essential groceries or things in your house to make a livelihood or living. Don't stir out. And I would really request you not to stir, especially citizens who are beyond the age of 60. Also those who have comorbidities like diabetes and hypertension. And if you have been on some medications for your cardiac stents or even your renal conditions, please do not stir out, because your susceptibility is there for the virus to attack. And we also know that from whatever evidence we have today, it is the respiratory system that gets attacked, which means your lungs and your breathing apparatus. So look out for the early signs, look out for the early symptoms. If at all you feel slightly unwell, immediately report to your physician. That's what I would recommend. So don't stir out, only if you have to. And if you can get the younger ones out to get your job done, that's the better option to do. So precautions are, I think, very much in place and expected to be taken.
So basically the symptoms should take precedence over the swab test results. So basically go on with your symptoms.
Yes, because the swab test results are more for the regulatory authorities, which means you could have a local corporation, or you can have the health ministry, or you could have an epidemiology department. It is for them to know what is the prevalence of this COVID in Nepal. Now, if you wait for the test results, I'll give you my example. So I had fever, I had lack of sleep, lack of appetite. On day 2 of this fever, which kept spiking despite me taking medicine for fever, like a paracetamol, I started developing lack of smell and lack of taste. Even that time, I didn't realize that COVID is around the corner for me. You know, we doctors are bad patients. So we sometimes go to treat ourselves beyond a certain level. It was only on day 3 of my fever that my son decided, who is also a periodontist, and he decided to drop in a pulse oximeter. And the pulse oximeter, here is what I have for you all. I'm sure you all know what pulse oximeter. This is very important because this gives you the oxygen saturation. And this started showing around 90. The ideal is about 97, 98, 99. It started showing around 90. That's when he said, I think you should be careful. I went for a blood test because of the lack of appetite. I thought it could be jaundice, it could be typhoid. So I went for my blood test. My blood test did not show, even the Vidal was negative. So I was content, oh, fine, this will go away. Once the oxygen saturation started dropping, then I was advised an HRCT, high resolution CT of the chest. Once I went in for the HRCT, that showed early symptoms, early signs of pneumonia. And this is when I was advised to seek a bed in the COVID facility because this was definite signs of oncoming COVID. Coming back to your question, Neil, what is symptoms more important? Yes, because on day 2 of my admission into the hospital, the swab test was taken. And on day 3 of the hospital admission, the test results came negative. Would you believe it?
Oh my God, yeah.
So the symptoms were there and the test was negative. So I don't know whether to be, at that time, to be happy or to be worried, because if the symptoms are there and the test is negative, what next? But gladly, I must share with all of you all, and I'm sure it's the same situation in Nepal. The medical fraternity will treat the signs and symptoms. They will not be bothered much about the test results. So if at all you have symptoms, just leave the test result for the regulatory authorities. Don't bother much and go ahead and get yourself treated for the symptoms.
Yeah, actually, even one of our, in the earlier days, one of my doctor friend, pulmonologist, she was telling me, same thing as yours, like there was symptoms, everything was classic, but the test came negative and the patient went home, you know, thinking he doesn't have it. And then again, after 2 days, he comes back with a more severe, and then finally it became positive. So it's you know, well, that's another question, one other point, right? If you have any symptoms, isolate, yes. Isolate, take any chance.
Absolutely, absolutely. And you could be one of the members in the family. The moment you feel unwell, go into isolation, okay, go into self-quarantine. And when I say self-quarantine, it's a room quarantine. You'll be the only person in that room. You will have your own set of utensils, crockery, cutlery, which you will wash yourself. That is the way to go ahead and isolate yourself.
Yeah. And one more question I would like to ask you. So when you said the symptoms started, can you make out how after, the probable exposure, like, so how many days did it take for you to start with the symptoms?
So we go back a couple of steps and we wonder, is there a way to know where did I pick it up from? And this
Yeah.
is what I want to share. There is no way as of today to comprehensively and conclusively prove from where you have picked it up. There is no way. You can only conjecture and speculate. So if I were to say that on the 11th of May, I treated my last patient. When I say I treated, it was a consultation. And after that, on the 29th of May, which means 18 days later, I have fever. And 2 days of fever, 3 days of fever and neglect. And the 1st of June, I get admitted. So it doesn't add up, right? It doesn't add up. And in between, was I exposed to somewhere else? A visit to a bank and 2 visits to a groceries. So I can't really say where I picked it up from. So I can keep on guessing. And okay, now I went a step further. The patient whom I treated last on the 11th of May, is everything okay with that patient and their family members? Yes. Which means it is not from that patient. So you can say, okay, it could have been some other patients. Well, we can keep on thinking, but there's no way to know. There's just no way to know. The day anybody can comprehensively prove that you have picked it up from a particular route, you will get a Nobel Prize. That's what I feel.
Yeah. Yeah, but normally they do say it's 5.1 days is the incubation period, right? So
yeah. Around the day, between day 5 and day 8 is very crucial, because that is a phase when you probably can spike in fever, in symptoms, and the complications related to cytokine storm, which I was very close to getting that. And allow me to explain that in a minute. What happens is, we all know that there is a defense mechanism in our body. And when there is an attack by way of an infection, the defense mechanism starts rallying around its army to fight this. Now, there is a cascading event. In that event, what happens is the defense cells go into an overdrive and they outnumber to such an extent they start attacking the healthy cells. This is called as a cytokine storm. Now, it is very, very common. It has been seen that people who have been afflicted with COVID slip into the cytokine storm, which then affects multiple organs, leads to multiple organ failure, and of course, effective death. To prevent that, the doctors will go by your blood test parameters. IL-6 is one of the parameter. D-dimer is another parameter. Then you have the CRP, C-reactive proteins. All these levels are checked. And if there is an abnormal elevation, they fear there's an imminent cytokine storm about to happen, and they'll pump you with suppressants. Now, your immunology suppressants are the ones which probably will make you now susceptible to other infections, which means if there's an underlying low-grade infection in any of your systems, that will start coming up. So it's a double-edged sword. But a life-saving drug like steroids, low-grade steroids, in my case, it was HCQ with azithromycin. There's a lot of debate whether it is good or bad. So what they do is, currently, Neil, they take a military approach. That means they put everything. Something has to act. Yeah. And when you know in a military approach, there's always collateral damage.
Yeah, absolutely.
Because of that, you also have to be very careful that you don't succumb to these measures. So you have to be monitored very closely. Even if your next test comes negative, even if you are discharged from the hospital, it's very important that you are careful, because now your resistance, your immunity is low. This is where I wanted to explain the cytokine storm.
Well, it's so now the dexamethasone's role, once you start having a issue with the breathing and all that, that's been proven also. This was before that, right? When you had this, so they did give you dexamethasone.
Okay, so what the medications that I was given when I was in the hospital was HCQ and AZ. azithromycin combination, one. Two was low-grade dexamethasone, and all this was IV, by the way, okay? IV, dexamethasone. Then I was given, and by the way, an injection on day 4 of my hospital admission called tocilizumab, tongue twister name, but tocilizumab is an immunosuppressant, which is given to control your cytokine storm. Because the time that I was in the hospital, remdesivir was not available in India. It is only available now, which is an antiviral. So I was given tocilizumab, and also all these patients are known for some clots to be developed. So I was also given an anticoagulant every single day for 6 days to ensure that there is no embolism. So these were the medications, apart from, of course, vitamin C's and the vitamin B's, and for acidity control, the Pandy, oh my God, a whole lot of medications. And by the way, what happens is your blood sugar shoots up, Neil, because of all the steroids that are being given, medication. Your blood sugar, even if you are a non-diabetic, it is bound to shoot up. So you're now given insulin as well.
Okay.
So these are the combination of drugs that was given. And slowly, of course, they all will be tapered once you're discharged, keeping in mind your other normal medication that you will come back to.
So, I mean, in your case, what was your oxygen saturation, the lowest that it
So
reached?
when I entered the hospital, it was around 90, 91. So the moment I went in there, they gave me a nasal cannula to supplement oxygen. They realized on day 2 of the hospital that wasn't adequate, so they gave me an oxygen mask. The oxygen mask gave me 100 liters, a liter of oxygen. Then it went on to 2. At best or at worst, it was 4 liters of oxygen. I never went on to a stage of a ventilator, like a couple of my friends did, yes. But and then it was slowly brought back. The challenge was to stay without the oxygen mask, especially when you have to go to the washroom, because then you can't carry the oxygen mask there. So for day 1 and day 2, it was a challenge. Even those 5-10 minutes, Neil, I had to struggle. And of course, then I bounced back.
Oh, my God, that's so. Now let's go back to your isolation days and things like that. So when you were all alone, now you're alone there. There's nobody else but your doctors and nurses around and all that. So how do you feel that me time in your isolation?
You know, I want to tell all the viewers, we always say that, oh, I want my me time, especially the working women who manage the household, who manage the naughty husbands, who manage the naughty kids. They say that, can I have some me time? The value and the meaning of me time actually penetrated my thick skull when I was in the hospital by myself, looking at the boring ceiling. And that's when all the thoughts come in, right? The right and the wrong thoughts keep coming to your mind. And you need to remain very positive. That's one thing that helped me, is to stay positive. And I come from a household which is very strongly spiritual. So when I was leaving my house, my wife slipped in a small, Hanuman Chalisa. I'm sure all of you all know of Hanuman Chalisa. So she slipped in that, and which helped me to recite that while I was in the hospital. Also, what helped was this friend called telephone. Cell phone. Because this is allowed. So once this is allowed, I ensured that I kept in touch with all my friends through messaging, through WhatsApp, and I could relay to them my status from time to time. It also helped me to catch up with a lot of things which I did not have time for earlier. I love music, so it helped me to listen to some music. However, the me time, extremely important if you want to ruminate, retrospect, and reflect on your life, which I did very, very effectively. So this has helped. This certainly has helped me to understand a few behavioral patterns of human beings. A few of my own family members, my kids, my wife, my friends to understand as to why would they behave in that particular manner. I'm trying to sort of understand, which helped me. Yes. So the me time is extremely important.
Beautifully said. Ruminate, reflect, and I mean, that's so. Did you? I mean, just this is off my head question. Did you think about dentistry at any point? You know, like did you read up something?
Fortunately, my son and daughter-in-law both are dentists, so I know that the day I went in, my clinic also was shut because my son did not want to take any chance. He also went into self-quarantine. So he dropped me to the hospital. So he didn't want to take any chances. He went into self-quarantine, and we put up a notice saying that we are shut for extreme COVID reasons. Because see, we need to be very careful. If we put up there that Dr. Kumarswamy is COVID positive, and unfortunately, Neil, there's a social stigma, and that is the reason why people are living in denial. Friends, let me tell you at this point in time, this is not HIV, where you have to be shy and scared and afraid. This is COVID. So if at all you're getting signs, don't go into denial because it can only make it worse. Accept it with reasonable clarity. Go ahead and get yourself checked and treated. This is a very strong message I want to leave with you all. So coming back to that clinic, did I think dentistry? Yes and no. I thought about all the work which was left half in those patients. I sent them a message that please bear with me. I'll be back in the clinic very soon. So that's the closest that I got to about dentistry. However, I wanted to caution my friends, my dental friends. So I did put a message in all the groups that I belong to saying that just be on the lookout for symptoms. And if there's anything more that you want to know, I'm here to help you with any inputs. Yeah.
Okay, so let me move on then. So your family and friends, I mean, of course, it must have been very difficult during this period. What was their reaction? Because they were left at home, can't come to see you also, right? They can come down, but they cannot see you in person. Is that right?
In fact, you mentioned about the doctors and nurses. So funnily enough, they're all in their PPEs. If today, Neil, if you line them up and ask me to identify them, I will not be able to because none of them, I could see their faces. They were all covered, okay? And coming to family and friends, yes, they were worried for sure, naturally. This is where one important point I want to share with you. I'm sure there are a few Rotarians watching this program. I love the four-way test of the Rotary Club. If you look at the four-way test, it says, is it the truth? Is it going to help build friendship? Is it going to be beneficiary for all concerned? The reason I mention this is WhatsApp on this phone can be very damaging. What happened was messages started floating around on day 2 of my admission. Morning when we wake up, Neil, we reach out to our phones, don't we? And we check the WhatsApp. And without thinking, we forward the messages. What I want you all to do is, any message which comes informing you all about a worried status of health or any information which is in the red zone, not the happy zone, the red zone, always subject yourself to this four-way test before you forward it. Is it the truth? Is it going to cause harm by just spreading it? Because this is exactly what happened. People send messages saying that, oh, Kumarswamy is positive for COVID and he's serious. In a few groups, Neil, and in a few groups, they said that age not being on his side, it is difficult for him to survive.
Oh my God.
That's okay. People will say what they have to say. But why I'm saying this, why I'm sharing this is, it doesn't help anybody. Whom does it help, tell me? It doesn't help anybody. So such messages, I think if you can refrain from and stay away, will certainly help into keeping the cluster of, and at the end of the day, we are in minority. How many dentists are we when you look at the global population? We need to stick around to each other. These are the times when you need to stick around to your family and friends. So encourage them, okay? Tell them that all will be well. We are all waiting for you. You're a fighter. I think there are many positive messages also, by the way. My friends send me positive messages. Hang in there. You're such a fighter. You will survive. You'll come back to tell the story. And here I am coming and telling you the story.
Yeah. No, absolutely. I mean, I guess this human reaction of this stigma has been created also by our own, you know, the scare by the medical as well as dental, other, spreading rumors, spreading things. People just want to talk about other people, rather than, so basically the four-way test is a beautiful, is the truth. The first thing, being a Rotarian, I'm an ex-Rotarian, and it's a great thing there. And now the next question is about the importance of medical insurance and standard precautions. I mean, what's your take on those things?
Every country, I'm sure, will have their own regulations related to medical insurance, like India has, and I'm sure Nepal also will have. So we must be very clear, as with advancing age, you must have medical insurance policy. B, you must have adequate medical insurance policy. C, please read the small print before you sign on that form, because suddenly the insurance company will say, sorry, this is not allowed. This is not included. So please read the small print. And the most important, ensure timely renewal of your policy. There have been cases, my close friends, it has lapsed and they said, oh, next week I'm going to renew it, next week. And then you are attacked with some condition. Then what do? Because today, medical treatment in our part of the world is not inexpensive, it's very expensive and elaborate. So one can't, you can wipe out the entire family's savings. So please ensure tonight that you check your medical insurance policy, and you'll also see whether you're adequately covered. More so with senior citizens in your family.
Absolutely. I mean, this COVID, more than anything, economically, is going to hit us so badly.
Yes.
I mean,
Yes.
If you see, the mortality is not that much, but the suffering, the hospital stay, hospital bills. I mean, this is what medicines, vaccine, the economy is going to suffer from every being's point of life. I think that's what it is. Anyway, let's move on. So tell us, I mean, has this whole saga you go through the experience, this has affected your outlook in your life? I know you've had a fantastic life. I mean, you've inspired so many people. You've done in your own fields. You have mastered. You've done there, been there, everything. But after this particular incident, has it changed anything? Any outlook in your life and livelihood?
Neil, you've been so kind into telling me that I had a wonderful life. When we look back at life, at 65 where I am, and if I look back, you'll say, yeah, we all have our shares of ups and downs, and I'm no exception, so we have that. Have I got what I dreamt of as a youngster? I think more than that I have, yes. Is there something which I would still like to achieve? Do I aspire? As a human being, the day you stop aspiring and expecting, I think you should stop living. Because we will always want something more reasonable, but we would like to look forward to. Now, a new feeling which has crept in is, because the future is uncertain, and my elders kept telling me that, that you never know what happens tomorrow. You never know what happens tomorrow. And there's a certain age where you don't want to believe in that spiritual talk. But now, when I've entered that phase, I said, yeah, I never bargained for this phase of 3 months. Nobody ever bargained for the past 4-5 months in this world. So what has it told me? Live for today. Carpe diem. Carpe diem, if at all it has a meaning, I think now I've understood that we can keep on living with the uncertainties and fear of tomorrow and with the agonies and ecstasies of yesterday. But what is important is to live for today, live for this moment. And this is what I think it has taught me, that the moment you wake up in the morning, exciting day, and the time that you hit your head to the pillow in the night, look up and thank the stars and the Lord that, oh, what a wonderful day. I think this is a very important learning which I have from this experience.
Absolutely. Like Buddha says, present, your real present is the present. The
It
rest we
is.
don't know. So
Yes,
it's
it is.
so beautiful. This really very close to the, living every breath basically. So
Yes.
enjoying every breath you take and just taking it positively and feeling good always. Uh, so, and now last, I have a few questions. That's it. I'm just going to ask you. Uh, so, your now the tips to all of us here on how do we now safeguard ourselves, of course, with all the safeguard also. You can give us some tips there. At the same time, bodily wise, immunity, all those, food and habits. Please, could you please say something about that as well?
One thing which is completely non-negotiable is the use of a mask. Like Neil rightly mentioned in the beginning of this program, that everything has sort of been, debated, discussed, dissected, and dismissed. But what has remained unquestionable, non-negotiable, is the use of a mask. So whether it is you, your family members, your patients, or passers-by on the road, educate them to use a mask. A mask which will be breathable, which means a cloth mask. And if at all you're getting into a procedure in your clinic, then a specified N95 mask. So the use of a mask is must. Two, make sure that you build up your immunity. There is no product which you can buy at the counter at the chemist which will help you with immunity. They're only called supplements. Essentially, your lifestyle and your health is dictated by a very, very strong positive mind. Now, there was a study. The study was they took a batch of students, they divided into two groups, and they checked the levels of IL-6, that is immunity levels, before they took this display. Where did they take them? They took them, one group batch was taken to Mother Teresa's home in Kolkata. Before and after, the IL-6 levels were checked. The other group was not taken there. They were taken to a place where it's full of negativity, like a jail. And they tested the IL-6 levels of that group. And they realized that the group which went to Mother Teresa's home, the immunity levels went up because the positivity in the mind and the heart, we also call them positive endorphins release. Now, when positive endorphins release, it helps the immunity. So staying positive in the mind is a huge factor. So stay positive. Whether it is by way of feelings or words, there is no room for negativity. It's all okay to say that your friendly neighborhood dentist, by the way, there is nothing like a friendly neighborhood dentist because the closest dentist that is practicing near you will always be at loggerheads. But that apart, nice things to say about him, nice things to say about your family members who may not be sort of in sync with your thinking, doesn't matter. So positivity will help to keep your immunity high. You can also then take care of the respiratory apparatus by some routines. The routines are like morning when you wake up and you finish with your ablutions, take a glass of warm water with lime, get used to drinking that. That helps. The next thing you can do is to take inhalations. If you have a weak sinus, take inhalations. What are we doing? The inlets of the nostrils, inlet of the mouth, these two gateways for respiratory attack, we are trying to embolden them. We are trying to make them stronger by introducing some precautions and care. You will say that if I do all this, I will not get COVID. Please do not hold me against it. Because if I do all of these things, if you have to be afflicted, you will. But immunity build up. Like for example, you're taking a vitamin C regularly. Healthy diet, keep checking your vitamin D levels. There cannot be excess of vitamin C, but there can be a harmful effect of excess of vitamin D. So make sure that you check those levels. And if at all they're falling short, go in for those supplements. Sprouts. Sprouts are healthy. Healthy food. I am no health expert here, but all I can share is towards immunity. We had a good webinar about 2 weeks ago with Dr. Sitesh Roy, an excellent allergist and immunologist from Mumbai. And he says the same thing too. You could be following Ayurveda, you could be following homeopathy, you could be following Iskapati, Uskapati, Anipati, but the important thing is for you to understand that as long as whatever you take does not cause any harm, go ahead, feel positive. It has to help your health.
Yeah. And of course, you'll agree with me on saying try to eat natural as much as possible rather than
Keep it seasonal, correct. Keep it seasonal, natural, and fresh.
yeah, seasonal. That's a most important part, right? You may get a like mango in the winter, but it's
No.
I think to eat. So seasonal, yeah. So and yeah, thank you so much. You know, I think these few things you've shared with us, I'm sure will really help us. I mean, it's really boosted our morale as well as. It's great to see you back in full form, first of all. And would you like to say something, you know, as your
are there any other questions? Because I saw some questions pop up in the chat box. So I could probably take them and then leave them with a message.
I've been asked. I'm just asking John Gurung, who's actually helping me out with the tech as well as the questions. He's asking the others now if there are any questions.
Yeah, there's a question saying that, am I back at work? A good question. So what happened was when I got discharged from the hospital, I was advised 2 weeks of room quarantine. And the reason for that, like I mentioned before, because of the immunosuppressants, my immunity was suppressed. So I need to be careful. At the same time, just 10 days out of the hospital, I don't think is a good time. You could infect others. So a room quarantine is advised. After that, I went to home quarantine for 2 more weeks. So totally about a month after I exited the hospital, I was at home. I did not go to work. And because my kids are dentists, they said, Dad, stay at home. We will call you if needed. So then there were a few times when I said, look, I'm sick and bored sitting at home. But slowly I started going only for essential cases that needed my attention. And of course, now I go alternate days for a couple of hours and back to work. There's also a question which popped up and said that, what about aerosol procedures? You have to take adequate precautions. What do we do in our clinics? We have our surgical gowns, and you all know the surgical gown that we wear. On top of that, we wear a disposable 45 to 65 GSM gown, a mask N95, and on top of that, a 2-ply mask, a face shield, eye protection, head cap. Go ahead and do your aerosol procedures. We have done away with spittoons. In fact, Neil, you would like Ajay and Mona Kakkar's philosophy. Years ago, they did away with the spittoon. If you recall, when you visited their practices, there was no spittoon. So the spittoons have been done away with. And we go completely with your high evacuation system. And yes, you can do your aerosol procedure. But keep it again to the most essential. Like earlier, we'd go ahead and allot patients one after the other for Crown and Bridge. Try to be conservative as much as possible. And I'm not saying don't do aerosol, but be very selective in your aerosol procedures. And the normal things. You heard so many webinars now about triaging and not crowding your reception area and allowing at least a 20-minute gap between 2 appointments. All that has to be followed. Yes.
Yeah, yeah. And tell me one thing, this thing popped up. A lot of dentists, a lot of doctors are kind of hiding this thing and, you know, not coming out. But you've been one of the persons from there, you know, like you've been open about it and you've helped so many people understand this and destigmatize the whole thing. I mean, what actually motivated you to do that? And
You know, this is probably the 12th or the 13th seminar that I'm doing. For the first time, somebody has asked me this question, and really appreciate this. As to, you're right, people are hiding, people are not disclosing. Now, I was trying to understand their psyche. It could be because of the fear that at some point in time, patients will get to know that they will stop coming to the clinic. Could be one of the reasons. Or the friends who probably wanted to visit you will stop visiting you. Your neighborhood will stigmatize you and start labeling you as a dangerous house and a zone to visit. These must be the thoughts that people must have gone through, and that's the reason they must have gone into a shell. What happened with me was, and you have known me for a few years, modesty set aside, I have always been a person, if I can help somebody not to walk the path that I have walked where I have fallen, then it is helpful. So I want to tell them that, look, this is not the end of the world. If at all you stay positive, and whatever experience you go through, if you can share, it certainly will help. It has to help a few people to stay away from that zone and fear. That's the reason that I come out and share. Yeah.
that's so beautiful. And I know, I know you're always, I mean, I remember you telling us this during one of the lectures also, that I've gone through all this trouble. I don't want you to go through it. So I share because I care. That's so beautiful. And that's, giving is always so nice.
Phenomenal memory, Neil, phenomenal memory. Because, that reminds me that I actually have to come and see Kathmandu. Because as you remember, when I came there for the conference, that night I got news that my mom is serious in the hospital. So next morning I had to rush back. So I haven't seen Kathmandu at all. So at some moment in time, I need to come there. Yeah.
No, absolutely. I mean, it'll be our honor, and we'll have a great time here for sure. Now we are massive, surge here. So the dentists are mostly closed down, and they're really worried economically, and basically rent and the salary has been for a newcomer. As you know, Nepalese dentistry is very young. I mean, I'm actually an old dentist in terms of Nepali dentistry, because everybody is under 40, 30, like most of them. So they're all been really worried about in terms of economics, and they're just opened a clinic. Now patients are not coming also. At the same time, you have a big issue with the staff and rent. Anything, I mean, any motivating words that you have for these guys?
So these are difficult times. Let's accept these are difficult times. I am not trying to dilute this particular period to say that, oh, you know what, everything will be fine. It will be fine. But during this time, it's important that we stay positive. 1, 2, if the regulatory authorities can be convinced, and Neil, this requires a lot of unity in your dental fraternity to make a representation that please allow us to attend emergencies and urgencies, and we will adhere to all the protocols related to caution and care. There is no way that we will neglect the usage of PPE to the most optimal extent. You don't need to go overboard and completely sort of be in 2 and 3 tiers of your PPEs. Like I mentioned before, if you, whatever I have used, if you stick to the same, you should be comfortable and fine. The important thing is the message to go out to the general public. Now, that is completely dependent on you. And you can see there behind John, Nepal Dental Association. So as an association, you need to give some information into newspapers, into publications, to improve the confidence among the people that look. We have always looked to our neighboring countries as an example, and we have seen that they too have gone through this phase a few months ago, and they have emerged pretty confident to treat patients. They've also gone ahead, and today almost I would say 65, 70% or 80% of dentists are back to their normal work. Similar thing will happen in Kathmandu. This is only a phase. But if we as dentists start panicking and creating an environment, oh, dentists are the main source of infection, so stay away, and we are worried. No, there is no evidence till today that dental aerosol transmits SARS-CoV-2. I repeat, there is no evidence as of today that dental aerosols transmit SARS-CoV-2. What it has proven is all aerosols do carry viral loads, but does not necessarily mean only SARS-CoV-2. So what would I recommend? If at all you get back to your practices, make sure the patient is subjected to a minute of chlorhexidine 0.12% or 0.2% rinse, because chlorhexidine, as compared to other mouth rinses, has the longest substantivity. So it will at least give you a good 1 hour window to do your procedure on the patient where the viral load is under control. So this is one tip I can share with you. Even if you want to take a povidone iodine, you can do that as a rinse. But chlorhexidine, there's enough evidence in these times to prove that the viral load is under control. So this is very important both for the dentists and for the general public. Now, the challenge for you, Neil, is to go ahead and take our medical brethren along with us. The medical fraternity also needs to believe that it is not so dangerous for dentists to transmit through their clinics. Now, you need to do it in your own nice manner of going hand in hand with them and giving out this message. This is what I would say. So, yes, these are difficult times, but this too shall pass.
Yeah, absolutely. All is well at the end of the day. So this time will pass. I think that's the hope we all have. So, any more questions, John? I mean, have you come across any question, anything from your side?
It was a nice presentation. Just one query. It's just struck in my mind. So, what was the reaction of your patients after you recovered and after you visited your clinic, and what were their reaction? Are they easygoing enough to work with you? Or something? Just a query.
Good question, John. Good question. Because that's an important aspect, you know. If patients feel scared and insecure, you don't want to sort of kill your own practice. So there was a very dignified manner in which I had to convey. And where I want to tell the viewers is, if anybody asks you a question that we heard you are COVID positive, immediately, instead of avoiding that question, evading that question, or putting some answer which is not relevant to the question, I think you should avoid. What you should do is take that question head on, as I did. I said that, yes, I have been diagnosed positive. I am under treatment. Very soon I'll recover and I'll get back to you. So the moment I came home that evening, as Neil would know, I put up a video message on my Facebook. Now, when you put on your social media, it is not only for your friends, even patients will see it. So they saw it. Then they messaged people who didn't even know earlier. Now they came to know. So they sent a message, oh, doc, we didn't know that you had, we are so glad you're back. So what happened is you have won them over rather than keeping them in the dark. Because see, if I am what I am today, it's only because of the love and the faith of my patients. So there's no way I'm going to keep them in the dark. After listening to my story, if they still feel fearful, insecure to come into my clinic, it is completely their prerogative. So I respected that. So I told them, this is what it is. Even today when patients come, doctor, we heard somebody told us that, to ask a question also, they will hesitatingly ask you. They will not openly ask you. So I said, of course. I went. And this is where what happened with me. I came out, and am I glad? Thanks to your prayers. And I tell them, it's actually, and I believe it. If at all this virus is ineffective, and I mentioned that the other day, Neil, if at all it is ineffective, I'm convinced the collective prayers, goodwill of your family and friends is what will nullify the effect of this virus. So yes, John, I did tell my patients.
It's because in Kathmandu also we have heard news that the places, the hostels, the local people are not cooperating with the doctors and the medical personnel. So I guess it's very important to trust us by our patients so that we can proceed with our normal walks. If we got positive also, it's not that it's not, it doesn't have cure, it has a cure. If we are cured enough, then we can proceed with our normal work also. But that the patients should be very much cooperative, and they should be very much understanding, I don't know, maybe. Yeah, but this, you had a very a difficult period, or you had a very heavy experience with COVID, and now you are coming with the normal procedures, and this will help us that how we will proceed in further in our scenario, because once in a lifetime, sooner or later, we all will maybe will have COVID, and that we will have to be taken in isolation, taken in maybe for touch wood, we will not have that position, but also someday we may need to go to hospital, may need to go to isolation. Then also we have to come back to our normal life.
Correct.
We have to go to our normal dentistry. So your story will definitely inspire many of us. And thank you, sir. And back.
I want to also tell John and Neil that you have my number, Neil. You can share it with the viewers if you want. Some people may hesitate to ask an open question on this forum. They can certainly WhatsApp me, and I can respond to their queries without any problem. Yeah, so feel free to share my number with them.
Yeah, that'll be really good. And to add to John's thing, one day or other we may get it. I think we've been very lucky in a way because we're not hit immediately after China. If that would have been the case, understanding of the disease would have been so much lower than what it is today. So we are, after 6 months being hit, some medicines are being worked out. A lot of trials have been going on. So we'll get it, but let's try to postpone until we, I think that will help us a great deal, and hopefully things will work out. But as you said, do things not now under full protection, of course, but we think show must go on, right?
Yes. It must. It will. I'm confident it will.
Yeah.
I've certainly enjoyed. Thank you so much for having me over. And like I said, in better times, I will come over and take the blessings of Pashupatinath and also visit.
Absolutely. We shall do that together. We'll go and we'll do that. And this whole interview of yours, I've recorded it and I'll be putting up as well. Is that okay? That's fine, right? And because there were some technical issues here and there with the usual one platform to the other, so I'll be
on Facebook.
Yeah, in Facebook, I'll share it right away. Thank you so much, Dr. Kumar. It's been such a pleasure, and have a great day and stay safe, stay healthy. And thank you very much. Thank you. All the good vibes from Kathmandu.
Thank you. God bless.
Thank you.